Hi, welcome to D-ConneXion TV. I'm Donzale Powell with D-Connex LLC. And today we're going to be talking about healthcare and healthcare solutions for pregnant women. Today I've got Alphonso Harvey with SurgPrep here today. So if you would just kind of give people an overview of who you are and kind of give us a little bit of
Sure.
information.
So I'm Alphonso Harvey.
Mhm.
I founded the parent company, Music City Med, 2014, and I created the brand Surge Prep and Help to Moms that speaks directly to our expected mom
Mhm.
population, based off of my own personal experience,
Okay.
becoming a father and a husband, and seeing how my wife, then fiance, was experiencing things in the pregnancy. Because I had been in medical equipment sales for about 8 years, I had a lot of things that could help people. We primarily focused on helping people recover from surgery. And we found there was a great benefit to the moms because I was noticing we would be at the house and she would walk around with our compression cuffs on, our back brace on.
Mhm.
And I'm like, sweetheart, darling, why are you using that now? Because it helps. And a light went off. And that's how we created Surge Prep and Help to Moms. So, based
Okay.
off my own personal experience, yeah.
Wow. Wow. Okay. So I guess today I would like to start off kind of getting to know you a little bit more
Sure.
and a little bit more about your company. So, can you elaborate on your services and really kind of walk us through some of your day to day activities as far as you helping your clients?
All right, so I'll start with me.
Hmm.
I came to Nashville back in 1995. Came here to play football at Vanderbilt. And it's interesting. I came here the first time in my life. I believe it was 1986 with my family when they opened the World Baptist Center.
Hmm.
So we were here for that. And little did I know, 9 years later, I'd be living here. And my father played football at Tennessee State. So my family has some history in this area. Came here in '95, played football, had a good time with that. Um, Graduated in '99 and started working in corporate America for UPS, and was there 15 years. Great
Wow.
company. They did well by me. But when you get in a large company like that, there's only going to be so many opportunities. So I had the strong desire to start my own business. And a lot of people don't know this, but Vandy football players, like during that time, you went one or two ways. Either you went to coaching or you went like medical sales.
Hmm.
So I was somewhere in the middle because I chose an engineering path, but then I got into sales and I talked to some of my teammates because I was ready to pivot. No, that's the big term now. It's
It
pivoting.
is. It is.
Well, I had a pivot before it was popular. And I talked to some of my friends and I said, hey, man, I want to get in your industry. And during that time, I was kind of seasoned, but there were some opportunities that were made available to me. And I got into the business about 10 years ago and I left UPS. It's been 8 years since I've been running my company.
Right.
Um, as far as the reason why I started my business, Music City Med, was personal. My father, God rest his soul, was a big advocate of non-opioid based pain solutions. He's a big man, uh, bow-legged like me, and his knees would bother him.
Hmm. Hmm.
So it was a situation where, am I going to take medicine or am I going to look for home remedies? So for growing up with mom and dad had knee braces, knee wraps, ointments. Oh, it just smelled like a Ben Gay commercial. It was crazy in our house, but anything to help him manage the pain.
Right.
And that helped me. That kind of was always stuck in my mind. And for me, as I got older, I had some of the same experiences. And I said, let's look for some alternatives to help manage the pain. Because I had early onset arthritis in my knee. I mean, football and being a big guy, it's going to happen. Um, so I started looking for products that interested me in that space, and it
Hmm.
became a business. We were helping a lot of people recover from surgery. We were helping people that were trying to get back to their healthier life. So it was a lot of knee braces and arm splints and things of that nature. Things you some people go to what's that, Walgreens or somewhere to get, but our stuff was clinical. You had to have a prescription.
Right.
So with that being kind of the basis of what I did, we were all over the place with our market. But for me, what really sold it, like I mentioned before, was um, expecting and then seeing how my wife really benefited from the products. And I knew my life was channeling towards a new direction anyways. And it was like my business, my personal, professional, everything kind of came together. And that's what was the creation. It was interesting. Where what I'm gonna tell you today really hit home. We were going to fly to our wedding, and we realized that we couldn't fly because my wife was still in the danger zone because she was a high risk pregnancy at the time. So it turned what was supposed to be 3 hours of travel turned into 21 hours.
Ooh.
Because we had to get in the car.
Right.
And she was nice enough to drive on the way back because I drove down. I was able to listen to, of all things, it was 22 Immutable Laws of Branding, because I really felt like I needed to reconstitute the business at that point because it was going to be about family. It was going to be about our personal interest. And during that, I really learned that you need to create a brand that directly connects with consumers. When I would say Music City Med, people would say, is it music? Is it medicine? Is it what is it?
Right.
But when I would say SurgPrep, the consumer automatically shortens your name, and surgery preparedness became synonymous with the brand that I was representing. And then we went even one more step further as we realized that we were going to focus on expecting moms, and we created Help to Moms. So we're just trying to make it very plain that of what we do.
What you do, yeah.
And our present world and COVID and all of that just really accelerated the path. I know I've had conversations with many consultants during that timeline to try to figure out where we were going to go.
Right.
And it was just interesting. I guess, in 2019, we did a lot of health fairs, 42 of them in between May and November. That was our business model. And then things changed with COVID. We had to get on the internet. So it's a lot to talk about in that space too.
Okay. So a couple of things. One, you kind of mentioned some of the issues that your dad had dealt with, and it just reminded me, and I never really thought about it as much, but you saying that reminds me of how my grandmother's knees, it was literally bone to bone at one point.
Yes.
And thinking about, usually when you're at that age, you're already taking multiple medications in a day throughout the day. So adding just pain on top of your just regular things that you need to have. That is a lot. That's a lot to deal with. Mentally, you're almost like, man, I could see how that could cause some people to be depressed or to kind of go on a downward spiral just because it's like, I give up. I'm hurting.
Absolutely.
And I'm tired of taking this. So yes, I can definitely see how important that could be.
Yeah. And a thing people don't realize, but from a statistic standpoint, do you realize that 2 out of 3 people suffer from pain?
Wow.
2 out of 3 in the United States. There's 3 people in the room, 2 of them are hurting, either periodically or chronically. And that was the basis of the business. And then we started getting more granular and focusing in on expecting moms.
Right.
So, I mean, there's a lot going on in that space. A lot of statistics that are really supporting what we're doing, and why we're doing it.
Right. I like kind of what I feel like is your evolution. And I'm sure that comes with maturity, with time, with challenges. You learn from them, and you, like you said, you kind of pivoting. But I love the evolution of as you became more of the family man and being more conscious of, I need to protect. I need to make sure that I'm doing everything that I can. So I really, really love hearing that.
Thank you.
Now let's dive just a little bit more into the actual products because I
Sure.
really want to kind of understand what types of things can assist pregnant women, and can you kind of walk us through how those products are able to help them?
Sure. So, if you look at the overriding statistics, the one that jumps out at me is 200. There's women of color
Mhm.
have 249% higher mortality rate during pregnancy,
Mhm.
and there's a lot of factors that go into that. Some are very soft that we can't quantify, such as, well, what was their diet? What was their environment? What was their stress level? I mean, there are people that can.
Right.
But what I look at is the blood clot, blood loss side of things. What we decided was three, we created a pregnancy kit,
Mhm.
pregnancy support kit. So there's a lot of conversation about maternal fetal health. And there's a lot of conversation about, well, what's best for the baby? Well, I go one step further and I say, well, what's helpful for the mom, right? Because she is doing the work, right? That
Mhm.
baby is surviving off of mama. And what can we do? Because when you're in that state, you can't take a lot of medication, right? I learned that quickly that Tylenol had to be discussed,
Yes.
and it became, oh, you can take Benadryl, right? You can, if you can take Benadryl. That's about it. So what we address directly is pain, and then we go back and we focus in on the potentially fatal part of pregnancy. So when we're talking about pain and a mom can't take opioids, well, how can you help? All right. Well, let's figure out where the pain is mostly.
Right.
Low back
I,
pain.
I was just about to say.
Low back pain. You know, the body, it's literally, it's first of all, it's physiological, the changes, and then it's also based off of the chemistry that's happening in your body. So because your body is changing, your hips are changing, the center of gravity is changing, all of that feeds onto your lower back. So what you see in the marketplace is people having maternity belts, and that's great, but it's a soft material that is elastic, and while you can comfortably adjust it the first couple of times, it doesn't provide any clinical support. That's why it's you do not need a prescription to get it.
Mhm.
We go one step further and we provide you something that does. And that's a back brace. You got to get a prescription to get this. Lightweight, you can adjust it. You know, the back is rigid, but the front you can move around your belly as you grow. It'll go from 24 inches in circumference to 60. And then we have extensions. So if you're carrying twins and you're having some pain, you'll be amazed the amount of women that call us or email us or just to thank us for including that. Second thing we do, because you can't take opioids, again, addressing pain, is we provide a TENS unit. Now in the UK and other countries, they actually use that during birth.
Oh.
Yeah, it's actually used by a lot of midwives and people in the profession to help the moms manage pain for people that don't want to take, they don't want to get that.
Epidural.
Oh my goodness,
Yes.
right?
I
Um,
remember. Okay, sorry.
yeah, flashbacks, right? They don't want to use that, so they use that to help with managing the pain.
Mhm.
That's how strong of a device it can be. For us, we recommend it for the moms if you got shoulder pain, if your feet are hurting, right? If your knees are bothering, you can put that on. You can provide yourself. I equate the device with being electronic Tylenol, right? You can use it as much as you want. It's not going to impact you. No, don't put it on your belly, please. Right? And all of this is administered under a physician's care. And then the third thing, which could save your life, and that the first two devices you'll definitely use while you're pregnant, you may or may not use afterwards, but a lot of moms still do. The third device is compression therapy.
Mm.
So if you ever go in the hospital and you're having surgery, they're going to put cuffs on your legs. And they do that because you cannot ambulate blood. And simply put, the action of standing helps circulate 90% of your blood because 90% pumps through your calves. So when you're bedbound or you're bedridden, you can't circulate blood.
Right, right.
So in the hospital, they're going to give you these cuffs and they're going to put them on and they're going to compress and release.
Mhm, mhm.
Clinically speaking, You have to have greater than 30 milliliters of mercury displacement. That's how much pressure is provided to ambulate blood. Well, when you put on compression socks, which is what most people are used to, they work great out the pack. They're between 30 and 40. But what happens when you wear a garment? It stretches, it loses that ability to compress. Well, we provide you with electronic compression therapy. So you can put those on your legs comfortably and it compresses and releases. Charge it 3 hours, works 10 hours. You can fall asleep with them on. So the mama's getting that blood circulation that they need. And then kind of the thing that we've added is breast pumps because mamas need breast pumps. And I could go on for hours about the benefits of providing that for your child. I'm going to tell everybody if you didn't want to do it for a short amount of time for your baby, especially during COVID, because they need that from you to supplement their immune system. So that's what we do. That's kind of the hardware. The part that really benefits moms in addition to that is we have a full-on telehealth system. You literally complete the application and now you're in our universe and you can at any point in time after that, because we're insurance based. Let me be clear, but we love TennCare. If you're in the state of Tennessee, we can help the military all over the world, literally shipped to Alaska to the North Pole yesterday. But we can help military moms all over the world. But in Tennessee, we focus on TennCare. And the reason we do that is because we want to leave no harm to the patient, meaning financial harm. So TennCare, we're in network with them, so they cover what we do 100%. And you're able to get access to that. But the thing is, after you get our kit, you can maintain a relationship with the provider. And if you need to see someone from your cell phone, no downloads necessary. You click on a link, you get in the waiting room, and you're rocking and rolling.
Wow.
You can do that from our platform.
So really making things as easy and accessible to people to meet them where they are, basically.
Yes. If you have 5 minutes, we can provide you with relief.
That is awesome. That's awesome. Yeah, I wish I had known that, 25 years ago.
Better late than never.
Right. No, this is good stuff. So obviously, you kind of alluded to it a little bit earlier, but let's talk about, of course, there's been some economic volatility during the pandemic. That has kind of happened. Of course, there's been administration changes, all kinds of things that can affect a business. So have you had to make any drastic changes, I guess, here more recently? And if so, can you kind of describe some of the ways that you've been able to make those adjustments to keep your business viable? I know you kind of spoke to the more targeted approach, and anything else that you can speak to.
So in 2019, pre-COVID, we did 42 health fairs and we were able to help in that time period 300 moms. It was I call it yeoman's work. I get a lot of pride and joy out of doing that. We were expanding what we were going to do coming out of January, February being planning months. And in the maternal world, kind of the baby fairs, baby shower events, they really happen March moving forward. So we planned. And I had a team, had an admin. We were going to be in front of 50,000 moms in March. Then COVID hit. So complete market dried up, had no viability. Long story short, we got good at the internet. And we started off failing, spending money that we didn't have, but this was going to be survival.
Right.
And the first thing that we did was, I said, you know what? All these mamas are still here. And regardless of what's happening in the world, they're still having babies. And they still need help. So how can I reach them? Well, how about I do a virtual baby shower? Let's give away $500 worth of stuff and give them an opportunity to hear me talk about what we do over here at SurgPrep, right? And I put it out, and 3 days later, we had 1,500 RSVPs. And I said, whoa, I'm on to something. And so from Mother's Day through the third week of November, we did a virtual baby shower every week.
Wow.
Yeah. So when people were starting to say, oh, I got to do something, I was like, Man, we 3 months into this. And then what happened was I was able to formulate a partnership with a great group out of our local health department. And they started coming in and they added additional services for the moms because the thing is, people want to help, but they can't reach the people.
Mhm, mhm.
But we know how to reach the moms. So that's been a great partnership. We've expanded that to another group that hits the outlying counties. Um, we're just here to be helpful, and if we're the vessel that gets to the moms, then so be it.
Right, right, right. So I guess if you can, and you spoke a little
Oh,
bit.
and the last thing I should say
Yeah.
is we had from January
Mhm.
to June of 2020, we had 0 clients. From July through December, we had 1,300 clients.
Yes.
Yeah.
Good, good, good. Yes, that's great. If you can give us a little bit of statistics. You kind of gave us a little idea. You spoke a little bit to um, the rates that are going on, particularly in African American women. But can you talk a little bit regarding the need for healthcare solutions for pregnant women? And are there certain demographics? You already spoke to one, but are there others that seem to be in need of those services more? And that could be from, are there income levels that you've kind of noticed are more than others,
Well
or
well, the thing is regardless of income, I
Mhm,
mean, of course, the super rich have everything.
mhm,
But the reality is people don't know what they don't know.
right?
So when we talk to the moms, I mean, whether they're the spouse of active duty or active duty themselves, or they're on 10 care in a small town, or they're a new mama and they just got that coverage, or they're a working woman and they're 36 and this is their second child and they're married and all. What we provide is innovative. So um, we are new, we are fresh, we are very specific, we are very much a niche, and we are driving the market right now. Now, are we as big as we're going to be? No, but it can get bigger.
Right.
Um, as far as from a statistic standpoint, 80,000 births happen in Tennessee every year. Now, if you ask anybody that's an OB, they're going to tell you that number is going to be much higher because of COVID. There's going to a lot of people. You're going to see a lot of babies starting now through first quarter, right? That number is going to be it's going to be much higher. There are 4 million pregnancies every year in the United States, so it'll probably be 4.2, 4.3. And what we need to do as a community, there's a lot of action. I work with a lot of partners that really are trying to drive down to help mothers of color. For some reason, um, there's a lot higher death rate in women of color, whether you fill in whatever you want on the spectrum from any minority group.
I was going to ask,
Yeah.
how is there a large contrast between African American and Hispanic women?
Same, similar and same
It's
issues.
close. Okay.
Similar and same. Now there are some communal things that really are helpful in the Hispanic community,
Mhm,
namely being the grandmothers in the house, the
mhm.
mama's close by, and the daughter is there. So they have kind of that
Support.
support. But from a medical standpoint, I mean, you follow the tea leaves: high blood pressure, diabetes, all these predispositions that are existing in the communities of color.
Okay.
They affect the outcomes from the pregnancy side too. So there's a lot of work that has to happen. Where I focus in on is where can I bring a tangible solution that can be helpful for the women today.
Mhm, mhm. So you spoke to the birth rate, pretty much how that should be going up for
Yeah.
various reasons. So have you heard any feedback? I'm kind of curious from some of the moms regarding, are a lot of them, especially during these times with COVID, are they moving more towards trying to seek alternate birthing methods, or they still going to the hospitals? Are they using doulas more? Like, what does
So
that look like?
so as far as that part, that is the doula markets. First of all, I think doulas are fantastic. We actually had a midwife.
Okay.
She was a doctor, nurse practitioner, but she was there for us
Mhm.
during the process, in addition to our OB, and that was extremely helpful to have a healthy, big old, pretty little boy.
Mhm.
Love that dude. Um, but the thing is, You know, I mean that market should grow and develop. I want to see more people take it amongst themselves to get certified, to get trained to do that.
Mhm.
The problem we're having with COVID, and we all can talk for hours about it, but our medical system is strained.
Right.
So when we went to the hospital to have Trey, we had people fighting over armbands to be there to be supportive. Now you're going in there by yourself, and maybe they'll let your husband or your significant other, or maybe it's your grandmother. One person. You don't have that community,
Right.
that encouragement, that support, because the health system is strained. We cannot have access as we did before. And so what I'm seeing is, mamas are still fighting for that. But here's something I saw in June of last year. You had moms doing their clinical appointments, their well checks with their providers in the parking lot. Literally. That it got to that point.
Hmm.
Right? And that was in June. We're
Wow.
almost, we're several months removed from that. So it's not improved. They're getting less care. That's why telehealth and being able to reach the patients where they are, it's so important right now.
Okay. So I do want to kind of give you the opportunity to talk about if there's any programs or any information that you just feel like, hey, the general public might need to know this. Any future events. I'm not sure if you're still looking to do future baby showers, things like that. So anything that you want to share, if you could just kind of go through those for
I'm glad you asked.
me.
So every week we do an event, but everything we're doing is virtual. So if you go to helptomoms.com, HELPTOME or HOL, let's see here, help to moms.com.
Mhm.
If you go on their website, you'll actually be able to see what we do. You're able to actually register for our services. And we have a great relationship with our local health department that enables you as a mom, if you live in Davidson County, you're able to register for our programs. So there's 8 programs with the local health department that are here to support you as a parent. One of which that we work with, if you live in one of the 7 zip codes, and they'll let you know that you don't have to worry about it. They'll find a way to help you, but just use our service and we can get you there. But if you're living in one of the 7 zip codes that they really, really are focused on, they're going to give you access to free nurse services at home, free doula services, free car seats, free pack and plays, free sleep safe sex. Got to say that fast 3 times. They're going to give you, there's about 30 benefits, housing assistance. If you don't have insurance, they can get you rapidly enrolled in Medicaid. Believe it or not, there's a lot of moms that don't have it. And they're really there to support you. So it's free. Just go to helptomoms.com. You enroll in our program, you're going to get access to our pregnancy support kit. We really, really love our 10 Care Mamas. We really do. We appreciate you so much. Also, our military moms. And if you have private insurance, of course, we work with you, but we just try to be a vessel to get you to the services that can benefit you as a mama. And then we're working every day. We work every day, and you're able to utilize our services 24/7, and everything that we provide is delivered to your door. So you don't have to go anywhere. You just need to have a phone to answer a call if need be, or to complete your survey.
All right. Sounds like an amazing resource. I definitely want to thank you for joining us today. And thank you for turning in to D-Connection TV.